I could have 1,000 patients who had definitively diagnosed type 2 diabetes, 1,000 patients, and I could treat them with non-drug therapeutics, with science-based, clinically verified, that's science-based, clinically verified medical nutrition, and they could all recover from their diabetic condition. No more type 2 diabetes. It's gone. And I can't post that testimonial on a website. I can't make a testimonial about that. I can't even say it in public that we can cure the illness, because according to the Food and Drug Administration, the only thing that can cure anything is a drug. This is a big, bad voodoo daddy. You know, and quite frankly, Alex, I couldn't be happier if the medical system collapses because we have taken the wrong dog to the hunt. I mean, the medical system doesn't need to be streamlined. The drug companies don't need to be reined in. There doesn't need to be more checks and balances, less regulation or more regulation. The reason that our health is going to hell in a handbasket is because we've taken the wrong dog to the hunt. MD-directed, pharmaceutical centrist, allopathic, reductionistic treatments for chronic disease don't work. This is the trillion-pound gorilla in the middle of the country that nobody is talking about. The best possible thing that we can do for our health is not to tweak the system, not to try to perfect the system, not to try to streamline the system. It's abandon the system. The only thing that MD-directed medical therapeutics are good for is surgery when surgery is absolutely necessary, and emergency care medicine. But the alternative practitioners, the naturopaths, the homeopaths, the herbalists, the acupuncturists, everybody who's not an MD has been kicked off of the bus of medicine. For goodness sake, the state of Illinois sued me for $5,000 because I used the word doctor on my website, and you can't do that. Now, I've been a licensed physician for 20 years. But it's not okay for me to use the word doctor.
Well, let's stop right there. Let's stop right there. I remember having Dr. Blaylock, who's a retired brain surgeon, but other people on 16 years ago saying you're going to see giant increases in diabetes as they put aspartame in thousands of products, not just soft drinks, equal NutraSweet brand names. We knew this. The studies were there in the 70s when they couldn't get it approved until 80. And here it is, CBS News last week. New study is wake-up call for diet soda drinkers. And let's punch this up for TV viewers. CBS News. And it goes over all of it. Artificial sweeteners tied to obesity, type 2 diabetes. It's an excitotoxin. It makes you more hungry and tricks your brain and fries your pancreas. They knew it. They know it's deadly poison. Diet soda associated with higher type 2 diabetes. No one's asking why is it up by 2,000–3,000%. Why are Hispanics dying left and right, especially because genetically it really targets them? Because it's wood alcohol, and we know what that does to Native Americans. That's what Hispanics are, Spanish mixed with Native Americans. It's killing them en masse, but you can't come out and say, Nobel Prize for medicine, Linus Pauling, mega dosages of vitamin C massively kills cancer, is a great treatment. You can't say that, even though it's Nobel Prize, but they can push 10,000 plus products with aspartame in it that kills people deader than a hammer.
500 million people die from Vioxx. 500,000. 500,000 people die from Vioxx. Nobody goes to jail. The leading cause of death in the United States right now, to the tune of 780,000 people a year, is MD-directed medical therapeutics. It's the leading cause of death. It's the leading cause of bankruptcy. While the MDs have been driving the bus of medicine, autism is skyrocketing, Alzheimer's is skyrocketing, life expectancy is flatlined. It's unbelievably poor outcomes, and nobody bats an eyelash.
Wow, going back to Jonathan W. Emord, sir, I've been throwing a lot of questions at you, a lot of points. What are some of the big attacks we've got on the supplement front going on? I mean, I know they've been pushing that as well because big medicine's in there, patenting, fish oil, changing a molecule, and then they want their competition that's 20 times cheaper banned.
Well, one thing that people need to really understand is that the censorship regime that the FDA operates is profound, and it is absolutely prohibited by federal law to make any treatment claim for a dietary supplement, even if it's true. So, for example, if you put on, and that's true of foods as well, if you put on the label of water, treats dehydration, you've just transformed the water by operation of law into an unapproved drug, and it is illegal to sell. You sell it, you can be thrown in jail. You put on any other thing, prune juice, you put on there, treats chronic constipation. you just transform the prune juice into a drug and you're thrown in jail. That's so even if the statements are true.
If you say cranberries are good for stones in your bladder or your kidneys, you can't do it.
Can't do it. And the reason why this regime is in place is that it is an anti-competitive system that ensures a monopoly on the right to make therapeutic claims for drug companies. They're the favored regulatee. The whole Food, Drug, and Cosmetic Act is designed to put the government in the place of protecting the drug approval process and thereby protecting an exclusionary system that limits to drugs the right to make therapeutic claims. A drug is not defined as a drug based on its chemical composition. It's defined as a drug based on the claims that are made, that is, therapeutic claims. So anything that makes a therapeutic claim is automatically categorized as a drug.
So it's a pharmaceutical monopoly. Wow. Jonathan W. Emord, we're going to come back with him. We're going into overdrive with Dr. Glidden today.